The world's biggest killer. That's the unfortunate title held by cardiovascular disease, which is responsible for one death every 3 minutes in the UK. Meet Mary. Mary wants to start a family with her husband, but like over a third of prospective mothers, she has unmanaged cardiovascular risk factors, such as central obesity. As well as putting her at risk of developing cardiovascular disease in the future, these uncontrolled risk factors increase Mary's risk of having serious pregnancy complications, such as stillbirth. Therefore, Mary's doctor correctly recommends that she gets healthier before getting pregnant. Mary and pregnant ladies in general are not alone. In fact, research has consistently shown that everyone would live longer and healthier lives if they controlled their cardiovascular risk factors. Unfortunately, many people do not completely understand their cardiovascular risk profile, so are ill-equipped to reduce it. For example, in our own surveys, we found that 73% of patients were confused about their cardiovascular risk and did not know how to reduce it. Our solution is HappyHeart. HappyHeart is a mobile application and virtual assistant that aims to help people both understand and mitigate the factors that put them at an increased risk of developing cardiovascular disease. Users input their health data into the app to calculate a risk category based on clinically validated risk scores. The app then highlights areas to improve upon and provides evidence-based plans to do this. Users then accumulate points and rewards that can be viewed by their GP for successfully reducing their risk factors. Whilst everyone would benefit from HappyHeart, our target end users will be pregnant women, postmenopausal women, cancer survivors who received cardiotoxic chemotherapy regimens, and people with inherited cardiac conditions. This is because research shows that these 4 groups of people would benefit greatly from cardiovascular risk reduction and have been historically overlooked. Additionally, these people are typically already engaged with health services, which means there is a clear way to connect with them and get them to use our product. We intend to focus on a B2B business model by selling annual subscriptions to organizations such as GP surgeries. There is a significant market opportunity for HappyHeart as the global cardiovascular digital solutions market is growing annually and is expected to be worth $160 billion in 2028. Compared to our competitors, we offer a holistic approach to cardiovascular risk reduction with a real focus on patient education. As a team of 4th-year medical students, we are passionate about reducing and preventing cardiovascular disease. With £2,000 funding, we could further develop our MVP and work with developers on our application design. Therefore, we ask that you join us to combat the world's biggest killer, cardiovascular disease.